So you can see that there's a movement of one staff in our daycare center. The tracking is his movement for one day. It's a lot of things that he has to do in a day's work within 8 hours. He has to walk more than 3 kilometers within our small facilities. This information can help us to understand the flow of our services, how we can improve the arrangement of the places. 100 years from now, we still need human touch to do the things that only us can do, not robots. They can only help us to save the work from service delivery, from service assignment, to keep us around the seniors more and more.
Sometimes it's not so much that services are not there, but for some reason, systemic or otherwise, people are unable to actually get their hands on services specific to our local Singapore setting. Subsidies can be a big challenge, subvention, payments. So I think in terms of the system, that can also be part of the reason why people might feel that it's inaccessible.
The reality is there's just so many gaps to be filled. When you consider how many persons with aphasia is affected and how their families are affected because they're not able to communicate, it is a social problem. We know that the reality is many persons with aphasia, caregivers, and healthcare professionals are not aware of community resources.
I actually came across this thing by Google. It's called Look to Speak. It's basically a simple eye tracker where you just gaze left and right, up and down, and you can actually use that to communicate across a very simple list of words. So technology actually moving at a very, very fast pace. It may be a little bit difficult, but I think again, if we keep our eyes open, our hearts open, there are actually a lot of things out there in the market.
I feel like if I have a wish, it will be for rehab professionals to actually have the opportunity to also cross from acute to community as part of our training. It is very different. The concerns of the patient, the families are very different as well in different parts of the recovery journey.
We are constantly looking for new staff. We are developing new programs in school, trying to train more staff to come into this work. But at the same time, we need to change the landscape of service providing. So this is more viable, this is more feasible and more desirable for the young man to come into these sectors.